I have provided privacy to my patient. Hi, my name is Zhiqin. I'm a nursing student from Oakland University. So today, I will be doing an assessment to your posterior and anterior chest, your neck and heart and abdomen.
Okay.
So what's your name?
Zhiqin.
So how are you today?
I'm doing good. How are you?
Good. So this assessment is going to take about 15 minutes. I'm going to start off with a couple questions, but before that, let me wash my hand first.
Okay.
So, Mr. J, have you had any problems with your heart, lungs, or abdomen?
No.
Have you had any surgeries on your heart, lungs, or abdomen?
No.
Does your family has any problem to their heart, lungs, or abdomen?
No.
Okay. Do you smoke?
No.
Vaping?
No.
Any alcohol drinking?
Occasionally.
Okay. So, do you have any drug use?
No.
Okay. So, can you tell me, do you have any? Have you had any problems recently for cough, shortness of breath, chest pain, edema, abdominal pain, nausea, or vomiting?
No.
Okay. So, can you tell me how old you are?
53.
Can you tell me what gender you want to identify as?
Male.
So, can you tell me who's the current president of United States?
Joe Biden.
Can you tell me where we are?
Northville, Michigan.
Can you tell me what date is today?
March 11th, 2021.
Can you tell me what we're doing right now?
We are doing an assessment.
So, he answered 4 out of 4 questions correct. His level of consciousness is alert and aware times 4. So his skin color is dark brown, and his facial expression is relaxed. His speech is clear. When I look at his face, it's symmetrical on both sides. He dressed appropriately for today. I didn't notice any body odor coming from him, and I didn't notice any obvious physical deformity. Now we moving on to the posterior chest. So can you take off your shirt, please? And then turn around. By inspection, the skin color is consistent with the rest of his body. Skin condition, I can notice that some markers on his back, also some hair as well. The spine is the midline to his body and is symmetrical on both sides. So now I'm going to do the palpation. I'm going to touch you to feel the temperature, okay?
Okay.
So he is warm to touch. Next, I'm going to do the test of expansion. So can you take a deep breath for me? So he appears to be symmetrical expansion. Next, I'm going to do the auscultation. So can you put your arms in front of yourself? So, Mr. J, just take a deep breath whenever you feel the stethoscope, okay?
Okay.
All right. So his long field is clear to auscultation. Next, we moving on to the neck. Can you turn forward to the camera? Start with the right carotid artery. His pulse strength is 2 plus with the regular rhythm. Now switch to the left. It's also 2 plus for the pulse strength with the regular rhythm. Next, we move into anterior chest. Now, so looking at the costal angle is less than 90 degrees compared to the anterior and posterior diameter to the transverse. It's 1:2 ratio, and his skin color is consistent with the rest of his body. I noticed some markings on his chest, also some hair as well. I didn't notice he using any accessory muscle. His respiratory rate is from 16 to 20. Next, I'm going to do the palpation. I'm going to touch you again for the temperature, okay?
Okay.
So he's warm to touch. I'm going to touch again for the tenderness. If you feel any pain, just let me know, okay?
Okay.
You feel anything?
No.
Okay, so next I'm going to do the palpation, auscultation. Just take a deep breath whenever you feel the stethoscope.
Okay.
Alright, so his lung field is clear to auscultation. Next, we moving on to the heart. I'm going to use the diaphragm to listen the high pitched sound. Starting with the aortic valve, it's to the right sternum at the second intercostal space, right here. Now we move into the pulmonic valve. It's to the left sternum at the second intercostal space. Now we're moving on to the tricuspid valve. It's at the left sternum at the fourth intercostal space. And last is the mitral valve to the left sternum at the fifth intercostal space at the mid-clavicular line. Alright, I was able to hear the S1 and S2 sound. Now I'm going to switch to the valve to listen the low pitch sound. I'm going to start over again. Starting with the aortic valve, then pulmonic valve, tricuspid valve, and then mitral valve. So I was not able to hear any murmurs through all the valves. So next we're going to do the abdomen. Can you lie down?
Okay.
Starting the inspection, I can see his umbilicus is the midline to his body and is symmetrical on both sides. And he appears to have a flat contour. Now I'm going to do the auscultation. Can you move your pants down a little bit? I'm going to use the diaphragm. Starting with the right lower quadrant. Now to the right upper quadrant. To the left upper quadrant. To the left lower quadrant. All right, I was able to hear normal active bowel movements in all 4 quadrants. Next, I'm going to do the percussion, starting with the right lower quadrant. Now, right upper quadrant. Now, left upper quadrant. Now, left lower quadrant. So I was able to hear the timpani sound. And next, we're going to do the palpation. Jay, if you feel any tenderness, just let me know. I'm also gonna feel the masses. Do you have any pain?
No.
Okay, he reported any. He didn't report any pain, and I also didn't feel any masses. So Jay, we finished the assessment. Now you can put your shirt on. Do you have any questions?
No, I'm good.
Okay, I'm going to wash my hands again. And thank you for your time, Mr. J. Thank you. I appreciate that.
Thank you.
Okay, I'll see you next time.
Sounds good. Thank you.
Bye.
Bye.